and healthcare innovations, to a large extent, we can stage them into 4 categories around care management, for instance. So, first category would be prevention, which is looking at decontamination of people. And in that, one innovation is developed by the Sreevas Sahasranamam Institute of Medical Sciences and Technology from Kerala, where they have developed something called a Chitra disinfection gateway. What it does is that it uses hydrogen peroxide and UV light to disinfect people who are kind of going through this gateway over a period of 40 seconds. So this is being used and it's sort of under testing, and it's going to be used at public entrances to spaces, so that people kind of go through this can be decontaminated of potential virus sources from their cloth and hand, for instance. But then it's not a cure for the virus per se, it just decontaminates it off surfaces. Another similar innovation comes from NPOL, which is the Naval Physical and Oceanographic Laboratory in Kochi, where they have created a UV-based disinfectant equipment that is being used in airports. In fact, in the Kochi airport, they are using this to disinfect luggage bags from the airlines. Another prevention equipment is the TMC shields, or the face shields, which you could develop through 3D printing machines, as I kind of discussed earlier on. But then in Kerala, we are seeing Kudumbashri, which is a women empowerment initiative. Women are making these face shields by hand, which is also a key preventive equipment that is helping us. Second category of innovations is in the sort of no-touch social distancing category, for instance. Karmibot, we already discussed earlier on. The other innovations involve things like a keychain tool, which is developed by this interesting startup called Safeguard. If you look at the picture closely, you can see that it's not very high-tech innovation per se. It's just a plastic tool of sorts, but then it can be used on surfaces like car doors to open the car door. It could be used at ATM machines or point of sale machines in shops to enter your PIN number, things like this, so that you don't touch the surface by your hands, and thereby you are not becoming a potential carrier of the virus. Another similar low-tech but high-impact innovation is what's in the last picture, which is the leg-operated water taps, which is developed by a NIT Calicut startup. It's basically like a pedaled water dispensing machine. So again, low-tech but high-impact, so that you don't have a contact with the surface. Telemedicine and healthcare at home has been there for a while. It's just that the COVID situation has accelerated their potential impact and scale, with startups like Practo and Clinic App really filling in the gap for these innovations. Third category of innovations come in with regard to detection and testing. We have swab collection related innovations. One is a manual one, which was developed by the Government Engineering College in Wayanad, which is the walk-in sample kiosk. Then we also have the IIM incubated robotic arm swab collection. So these are swab collection based innovations. And then we have testing innovations. And one example is the Sreevas Sahasranamam Institute of Medical Sciences Gene Lab, which is now being commercialized, now under approval, and then planned to be commercialized through the startup called Agape Diagnostics, which is based out of Kochi. Another interesting innovation is by Cure AI. They already had an app that was doing X-ray detections, and now they have added an additional feature where they help us with doing chest X-ray detections, and thereby potentially identifying if there is a COVID patient, if the X-ray shows the indication of a COVID possibility, for instance. So that's again an interesting innovation that's helping us with detection and testing. Final category is with advanced care, and in this category we have things like artificial manual breathing unit. The interesting element about this is that we had these ventilators in the past, but then given the nature of the COVID situation, we wanted innovations where it could be manually operated without a bystander or an additional person being in close contact with the patient and then needing to operate it. So that's the interesting element with the artificial manual breathing unit innovation. Another similar one is the Jeevan Light. And the interesting element about this ventilator is the low cost, portable, low energy requirement aspect, which makes it ideal for employing these innovations in rural areas of India.